I dislike the term quack, especially when applied to my profession, the chiropractic profession. We all have individuals within our profession that don't practice in an acceptable manner. But when someone's using the word quack, it usually carries the implication that they know something someone else doesn't, that they're superior to another person, and that is rarely the case. What it actually implies is that that person believes that they are right and often has a closed mind to the opinions or the science that another practices. So knowing that my profession typically hears that word quack used against us, I wanted to give you a few examples of the medical profession, but yet I want you to understand that I am not using these examples to disparage that entire profession, but rather to show you that what was once considered the science of the day is completely unacceptable right now. I'll start with Dr. Semmelweis, who in 1847 proposed that proper sanitation was important to prevent the excessive infant and maternal mortalities of the day. He was ridiculed by his peers as being unscientific and a quack. How many lives were saved when that procedure was adopted? In 1957, thalidomide was an accepted and scientifically validated clinical practice for providing this medication to pregnant females who had morning sickness. Yet it was then determined to result in adverse effects in 10 to 20,000 newborns. 40% of those died, and the ones that survived had severe limb, eye, urinary tract, and heart problems. Remember, this was scientifically validated as a medication. Now, in 1998, thalidomide was found to be beneficial for certain types of cancers, such as multiple myeloma, but that does not discount the harm that was caused going back to 1997 for those individuals where it was scientifically prescribed. Between 1937 and 1967, Dr. Walter Freeman toured the country performing frontal lobotomies for people who were suffering from depression and headache. There was a 14% mortality associated with that clinically, scientifically validated procedure. He thought it was successful because he said none of his patients ever returned. A couple more examples of some clinically validated medical procedures from the early to mid 1900s. Cocaine was used to help with dental pain. That's the only time people wanted to go see the dentist. Doctors promoted cigarette smoking as being emblematic of health and vitality, and heroin was used as a cough suppressant, especially in kids. Well, at least they slept through the night when they took it. Many of you may recall the Vioxx scandal. The drug was introduced in 1999 as an anti-inflammatory, eventually being recalled in 2004 after it was found to have led to between 88,000 and 140,000 adverse cardiac events. Merck Pharmaceuticals, the manufacturers of Vioxx, knew about this, but they hid that information in their research. So yeah, we can always trust the research that's being done by our pharmaceutical companies. And these medical errors or scientific abuses aren't just in the old days, it's still happening today. You can see here in this article the number of useless surgeries performed in the United States. It's estimated to be over 200,000 low back surgeries alone, resulting in billions of dollars, with the estimated success rate of those surgeries, especially fusions, to be somewhere between 40 to 60%. And then finally, to close out this example, is an article that was recently updated in February of 2024. And you'll note that this study showed that 400,000 hospitalized patients experienced some form of preventable medical error, and up to 200,000 people per year die due to medical errors. The examples just given aren't meant to disparage the entire medical profession. Obviously, there's a great deal of good about that profession, but they're meant to illustrate that you can't use selective examples and make that representative of an entire profession. You can't do it with medicine. You can't do it with chiropractic. All we can hope for is that each of us in our professions keep an open mind to how we practice and that we respect the way others practice, knowing that there's always a chance we could learn from that. I like to follow the advice of Einstein, who said, "True learning can only begin when one forgets all they think they know." In other words, Einstein, one of the smartest individuals ever, recognized that we all have to have a sense of humility about the knowledge that we think we have.